Hello guys, so let's continue with our series of protein synthesis inhibitors. So today we'll talk about macrolides. Macrolides. So some of the examples of macrolides are azithromycin, clarithromycin, and erythromycin. So let's learn a little bit about its mechanism of action. It blocks the process of translocation, which is the process of synthesis of protein from bacterial RNA. So it binds to 50S subunit, ribosomal subunit. It covers many gram-positive cocci. So it covers many gram-positive cocci, especially especially it covers streptococcus, and also have some few gram-negative coverage. Some gram-negative coverage. It is also concentrated inside macrophage and other cell. So it is effective against intracellular organism. So effective against. We have already studied our previous video uh, that aminoglycoside was not effective against intracellular pathogen, but macrolide, which we are studying today, is effective against this intracellular pathogens such as chlamydia and legionella. So let's study about its uses of macrolides. So it is used in community. It is used in community acute pneumonia because azithromycin and also macrolide covers streptococcus as influenza and atypical organism. It is also used in chlamydia infection as azithromycin is safe during pregnancy. As azithromycin is safe in pregnancy. And this macrolide is also co-administered with ceftriaxone plus this macrolides to treat gonorrhea. So this combination is used to treat gonorrhea. So let's learn about a little bit about individual drug. Let's learn about erythromycin. So erythromycin is like it binds to motilin receptor in our GI tract, and it stimulates the smooth muscle contraction. So it stimulates smooth muscle contraction. So this is the reason why there is diarrhea. Diarrhea in patient taking erythromycin. And due to this, as it stimulates smooth muscle contraction, it is also used in GI motility disorder. So apart from killing pathogen, it is also used in some GI disorders as it stimulates smooth muscle contraction. And due to this, the side effect is diarrhea. And let's know about clarithromycin. Clarithromycin is also a part of triple therapy for H. pylori infection. So it is a part of triple therapy for H. pylori infection. So let's learn about its side effect. Side effect of macrolides. So the most common side effect is nausea, diarrhea, and abdominal pain. Nausea, diarrhea, and abdominal pain. Why these side effects are occurring? Because of GI motility, because it increases GI motility. So these side effects like nausea, diarrhea, and abdominal pain are occurring. And among all these all these macrolides, erythromycin is the worst offender. So it is the worst offender. So people taking this azithromycin has more side effect than other macrolides. And second side effect is it causes prolonged QT interval in ECG. Prolonged QT interval on ECG. So among all the erythromycin, all macrolides, erythromycin is also the worst offender to cause prolonged QT interval in ECG. And another side effect is it causes acute cholestatic hepatitis. As a result, there's increase in AST, ALT, alkaline phosphatase level, and increase in bilirubin level. And another side effect of these macrolides are rash. It causes maculopapular allergic reaction. Maculopapular allergic reaction. And it causes, and another side effect is it is a P450 enzyme inhibitor. So it will rise serum levels of P44 metabolized drugs like warfarin and theophylline. So drugs like warfarin and theophylline are metabolized by P450 enzyme, but this enzyme is inhibited by macrolides. So the blood level of warfarin and theophylline will be increased in the patient who are taking these macrolides. So let's move on to another drug, that is chloramphenicol. So chloramphenicol, which is another protein synthesis inhibitor. So chloramphenicol, it covers both gram positive, gram negative, and atypical organism. So it is safe to use in pregnancy. So it can be used in pregnancy instead of doxycycline. But it is safely used in pregnancy in only first and second trimester. In first and second trimester. But it is not used in third trimester because there's increased risk of developing gray baby syndrome. There's increased risk of gray baby syndrome. So this drug chloramphenicol is used in first and second trimester, but not in third trimester, because in third trimester there is increase of risk of developing gray baby syndrome. This drug can also be used in meningitis. It is not used in developed country, but it is used in developing country like ours, as it covers meningitis. So it is used in covers Nigeria. So it is also used in meningitis. So let's learn about adverse effect of chloramphenicol. So number one side effect is it causes anemia, because it is a bone marrow suppressive drug. It causes bone marrow suppression. And another side effect is aplastic anemia. And as I have already told, it causes gray baby syndrome. So let's learn what is gray baby syndrome. Gray baby syndrome. If the mother takes this chloramphenicol on her third trimester of pregnancy, then she may develop gray baby syndrome. So let's learn what is gray baby syndrome. So gray baby syndrome is like we all know that newborn requires UDP glucuronide transferase enzyme for bilirubin synthesis or metabolism. For bilirubin metabolism and synthesis, they require this enzyme UDP glucuronide transferase, which is so the baby who have gray baby syndrome, their skin turns into ashen gray color. That's where the name came from, gray baby syndrome. And the baby become hypotensive, and is often fatal and may result into death of the fetus or baby. So this was for today. Thank you, guys.